Hello everyone, my name is Marcus Williams. I'm a student in the MA in Counseling and Spirituality program at St. Paul University. It is November 19, 2020, and today I will be discussing the topics of the causes and symptoms of dissociation and related disorders, and lastly, how might a therapist plan to treat such clinical issues. The motivation for this research report was to provide further information of dissociation and related disorders for therapists to have a greater idea of what to spot during assessment and clinical interviews. This research report is intended to act as an educational tool for counseling students, educators within the field. So there are various forms of dissociation, some by feeling detached from one's body and observing the world from the outside, to experiencing the inability of remembering key personal information. Therefore, the following are what constitute as dissociative disorders. For depersonalization and derealization disorder, clients will exhibit symptoms of feeling cut off from oneself of their body. They might even describe experiences as a dream. For derealization, the client expresses that the world feels or appears odd or unfamiliar, which includes people appearing robotic or dead. These symptoms become chronic and causes distress or disability to the client's interpersonal domain. Surprisingly, about 50% of all adults have experienced at least one episode of depersonalization and derealization, but usually these symptoms do not develop into a chronic illness. The second disorder is dissociative amnesia. Symptoms of dissociative amnesia must suffice two rules for diagnosis. The patient must have forgotten key personal events, and that other disorders do not better explain the client's clinical illness. Dissociative amnesia can exhibit of the following patterns: localized, selective, generalized, continuous, systematized, and dissociative fugue. And so the tip for this one is that general dissociative amnesia is a real illness and has occurred to a family friend of mine. This individual, years ago, was riding a motorcycle on the highway and was going very fast and accidentally hit the back of a garbage truck. His symptoms were generalized dissociative amnesia. He had no memories of who he was before, how to eat, how to go to the washroom, his own family. But over the years, he relearned who he was and has a family now. The third disorder is dissociative identity disorder. Clients must possess at least two or more appearing identities, which could adopt separate names. These clinical issues can be viewed as pathological possession, but it must not be recognized from an accepted religious practice. Often these symptoms come to light when a close relationship notes the changes in the client's personality. So the tip for this one is that children are not diagnosed with DID if an imaginary friend is mentioned. And lastly, the onset of DID occurs during childhood and is often linked with sexual abuse. There are other notable symptoms of dissociative disorders. There's acute dissociative reactions due to a stressful event, and lastly, dissociative trance. Therefore, so what are the causes for dissociative disorders? And so with a mini literature review that I've done, researchers have theorized two explanations for clinical dissociation. The first is that pathological dissociation is a response to antecedent traumatic stress, including severe pathological abuse and adversity. Or the second theory, secondly, dissociation occurs from a proneness to fantasy making and ultimately creates memories of trauma. The first explanation has received consistent evidence with moderate strength and significance, whereas the second theory about the fantasy making was not as significantly suggested or backed up. In summary, research supports that dissociation is a regulatory response to fear with biological reactions. So back to the first theory, that it is a response to trauma. So treatment options. Potential treatment options can include art therapy with imaginal exposure, systematic desensitization, fear ladder worksheet, resiliency enhancement training, and lastly, cognitive restructuring techniques within CBT. And so lastly, there are some evidence that dissociation decreases information processing within the limbic system. And lastly, dissociation is linked to enduring interpersonal violence. So those were just additional facts that I just found through my lit review. And therefore, thank you for this presentation, and I'd like to just end with a little comic. It's called Cat Behavior Explained by Multiple Personality Disorder. It's just a little joke about how the cat wants to go outside. This is his alter personality. He goes outside, he sees the door close and becomes triggered, which is a joke. And cat switches to his other alter. And then he experiences some amnesia and wants to come back inside or go back outside. So it's just a little joke. And all right, thank you so much and have a great day.